Thank you. Good morning.
One of the meetings, we want to make sure we coordinate, even inside of y'all jacket.
Look, she can trust us. Uncle, come on, Spring, come back. We waiting for you.
Don't leave.
Thank you.
Wait, were you finished? You weren't finished. That.
Question, do you they can do
With what? The last three? No, that's high school and deliberative. So you all won't be caught off guard when I read the top and you know what you're voting on because those waivers are in there. And I hope they don't.
Yeah.
Thank you, appreciate that.
No. How you doing? How are you?
Hey. This is too many pages. They better make She's all the way in the back.
Oh, yeah.
I saw her with Amy at the Wistful Sportsplex ribbon cutting.
Did Tony tell you about the water authority?
And it was like, I'm like, that can't be her anymore. Like, old meeting.
Oh, okay.
Because I hadn't seen her in years. Yeah, that's what I'm saying. I was like, when did you show up?
After we do the resolution.
I think she gets it from you.
If you're here for the first time, yeah, if you plan to speak during public comment, there is a sign-in sheet.
Somebody took the ink?
Somebody took the pen.
Somebody took it.
Who took
I
the
didn't
pen?
Take it. I only look for a name.
All right, I think we're ready to go. We ready, Chris? Chris, thumbs up.
They be over at the desk. Oh, I see.
And good morning and welcome to the City of Chester Council meeting for today, Wednesday, August 13th, 2025. As always, we open this meeting with a prayer and a pledge. This morning's prayer is going to be brought to us by Pastor Mike Nelson from the Grace Community United Methodist Church. All rise.
Good morning. Let us bow our heads if that's your practice. To the only wise Creator, thank you for another day. Thank you for another opportunity for us to be here. God, I pray that you would protect this city. God, I pray that you would allow our elected officials to come together, to work together to do a great, even a better job in our city. And so, God, we ask that you would be with them during this meeting, Lord. And everybody that is in here, anybody who is going to speak, anybody who's going to talk, I just pray, Lord, that as we leave this meeting, Lord, that we will be unified so that we can do what's in the best interest of your people. And so, God, I ask, Lord, that you would look from heaven and that you would smile upon your beloved city. And we ask all these things. Amen.
Amen. Thank you, Pastor. Let's see who's here today. Madam Clerk.
Councilors Gibson Williams.
Present.
Green.
Present.
West. Present. Davis. Present. Mayor Roots.
Present. Can I get a motion to approve the minutes from July 23rd, 2025?
So moved.
Second.
All those in favor indicate by saying aye.
Aye.
There are none opposed. Motion carries. Thank you. Does anyone have any public comment on agenda items only? If so, step to the mic. Step to the podium.
Good morning, Mayor Roots and City Council members. My name is Daryl Jenkins. I am the executive manager of the Chester Water Authority. I appreciate the opportunity to take a moment at the top of your agenda to discuss an item that the Chester Water Authority has great pleasure in supporting the city with. So the upcoming Peace, Love, and Unity Festival, which is scheduled for mid-September, Chester Water Authority received a request from the Honorable Councilman Green to help support that festival. I am here today to present Chester Water Authority's donation in support of this important event. Okay.
All right.
Thank you.
Our board of directors at their July meeting voted to provide support in the full amount allowed by the Pennsylvania Municipal Authorities Act.
Thank you so much. We appreciate your support. Thank you. Thank you.
Thank you.
Will. I'll wait till he leaves. He broke all the rules. I was going to introduce him. It's his first time in City Hall. But most importantly, I'll repeat, his name is Darrell Jenkins. He is the executive manager or the CEO or the boss man of Chester Water Authority. And, you know, he did come here for that purpose. Obviously, it's not on the agenda, but who am I to tell the guy who gives us clean, safe water every day to have a seat? So I guess he had something to do.
Yeah, everybody has to work, right? Okay. Items that are 95 and R96. I see that there is some development that's going to be taking place. You're consolidating, whatever, off of Morton Avenue. When do you, after it's approved, when is this project anticipated to begin?
Paul?
And that's R95.
Good morning, Mayor and Council. My name is Paul Fritz. I'm the Planning and Zoning Director for the City of Chester. For 95, which is Liberty Housing Development Corporation, they have an office building and some residential units proposed. Some of the work depends on just obtaining final funding for that project. As required by the MPC, they need to break ground within at least 5 years. We're anticipating they would break ground within a year. They're trying to fast track this project as soon as possible.
Okay, what about R96?
96 is called 742 West Front Street, but it's a little misleading. It's actually a project that fronts on 2nd Street, and it's a large warehouse, approximately 57,000 square feet, which includes office space, a training center, and some loading docks. That project also is on a fast track, and I believe it would break ground within a year as soon as approvals arrive.
So that is not the property that's currently down there on 2nd Street where you level, where you're going to build your garages for the
Public Works facility?
Public Works facility.
No, it's 2 blocks roughly to the east. It's where the large building that was recently demolished occurred. So it's between Curlin and Ulrich, yes. Thank you.
The old strong, I never can say it right, plumbing supply.
Curlin and who? I'm sorry. Of the repo, the building that you've already leveled that's across from the restaurant?
Yes, yeah.
Okay. Thank you.
Okay.
And you may have seen the article. This is the new Power Home remodeling. This will be their one of their headquarters there. Their training center. No, this is an addition, I believe, right?
Potential replacement addition.
All right. Council, any old business, new business you'd like to share? Let's go right into it, Madam Clerk.
Resolution, whereas Chester City Council, wait a minute, I thought my handicap was first. my resolution is stapled to the back. My apologies. Whereas the following individuals have requested a handicap parking zone. Number 1, Wilbur Lee Coley, 1143 Keystone Road. Number 2, Rhonda Ennett, 336 Parker Street. Number 3, Kumar Carter Springfield, 2521 West 9th Street. Number 4, Donna Hill, 2907 West 9th Street. Number 5, Leon Good, 1306 Balklain Street. Number 6, Dara Jordan, 329 East 20th Street. Number 7, Barbara Wilson, 505 Wilson Street. Number 8, Charlene Calhoun, 2602 McCary Street. And Gregory Cooper, 2018 Upland Street, all in the city of Chester.
So moved.
Second.
Any questions or comments? All those in favor? Oops, that's your job. I'm sorry.
Councilors Gibson Williams.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, whereas Chester City Council approved Resolution 76-2025 on June 25th, 2025, awarding Phase 1 of the Chester Business District Facade Beautification and/or Improvement Program, American Rescue Plan Act, known as ARPA, Project Number 37, known as the project, to LSN CM&E, otherwise LLC, otherwise known as LSN Contractors and Construction Managers. And whereas it has been determined that there is a need to amend the scope of work for the aforementioned project. Now therefore the Council of the City of Chester does resolve that it does hereby authorize an amendment of the original agreement with LSN CM&E LLC, otherwise known as LSN Contractors and Construction Managers, to withdraw 531 through 533 Avenue of the States from the original scope of work and reduce $95,060.80 from the original contract price of $237,946.19 for a new project amount of $142,885.39. Further, it does authorize the proper city official to execute said amendment for and on behalf of the City of Chester.
So moved.
Second.
Any comments or questions? Madam Clerk?
Councilors Gibson Williams.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, whereas the City of Chester has been awarded $1,300,000 in federal transportation alternative set-aside program funding for the Norris Street Trail and Streetscape project. And whereas the City of Chester desires to enter into a transportation alternatives program reimbursement grant agreement with the Commonwealth of Pennsylvania, acting through the Pennsylvania Department of Transportation for the Norris Street Trail and Streetscape project. Now therefore the Council of the City of Chester does resolve that it does hereby designate Thomas Moore, Chief of Staff, or Andrew Heyman, Public Works Director, as the official to execute all documents and agreements between the City of Chester and the Pennsylvania Department of Transportation to facilitate and assist in the reimbursement.
So moved.
Second.
Any comments or questions? Madam Clerk?
Councilors Gibson Williams.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, the Council of the City of Chester does resolve that it does hereby approve entering into an agreement with Consolidated Rail Corporation, known as Conrail, for the installation of a multi-use trail along Norris Street between 2nd Street and the Chester Riverfront Trail which requires construction that crosses the Conrail freight line. Further, that it does hereby authorize Thomas Moore, Chief of Staff, to execute any documents necessary for the completion of this project for and on behalf of the city.
So moved.
Second.
Any questions, any comments?
Yes, I have a comment, a question. So the building, when we were discussing in the deliberative meeting, it is gonna have safety features put up so that children won't be able to get abroad? Is that not this one?
This is a different project. This is the North Street Trail project.
Okay, okay, I'll wait. Sorry about that.
Any other questions or comments? Madam Clerk?
Councilors Gibson, Whamms.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, the Council of the City of Chester does resolve that it does hereby authorize the proper city official to submit a grant application to the Department of Housing and Urban Development, known as HUD, for the Lead Hazard Reduction Grant Program to improve the health outcomes for children in Chester by assessing homes for lead risks and remediating lead hazards in an amount not to exceed $4,400,000 with a 10% grant match requirement. Further, it does authorize Mayor Stefan Roots or his designee to execute the aforementioned application and other necessary documents for and on behalf of the City of Chester.
So moved.
Second.
Any questions or comments? I just want to thank Dr. Kristen Motley, our Commissioner of Health, for continuing to bird dog all these grant opportunities, and her success rate is very good. Madam Clerk?
Councilors Gibson, Whamms.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, a resolution of the City of Chester, Delaware County, Pennsylvania, granting preliminary and/or final approval to Silvercare Senior Housing for its overall master land development plan for the development of a senior assisted living facility at 2500 West 9th Street, Chester, PA.
So moved.
Second.
Any questions or comments? Madam Clerk?
Councilors Gibson, Whamms.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, a resolution of the City of Chester, Delaware County, Pennsylvania, granting preliminary and/or final approval to Liberty Housing Development Corporation for its subdivision and land development plan for the development of a mixed-use development at 1100 through 1130 Morton Avenue, Chester, PA.
So moved.
Second.
Any questions or comments? Madam Clerk?
Councilors Gibson, Whamms.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes.
Resolution, a resolution of the City of Chester, Delaware County, Pennsylvania, granting preliminary and/or final approval to 742 West Front Street LLC for its subdivision and land development plan for the development of a mixed-use development at 742 West Front Street, Chester, PA.
So moved.
Second.
Is there a question or comment on this one?
Yes. So I was concerned about the safety of the children that may play in alleys. Will there be some kind of safety measures put in place so that children won't get hurt?
I think this is going to be a marked improvement over what you had there prior to that Stong property being demolished. You have those logs and burning was going on across the street. I believe the development will be fenced in, so I think that'll be a dramatic improvement over what the status quo has. So I think it'll be, we'll work with anything that needs to be done to improve the safety of that particular street. You're talking about Cortlandt Street, I assume?
Yes.
Yeah, yeah.
Thank you.
Any other questions or comments? Madam Clerk?
Councilors Gibson, Whamms.
Yes.
Green.
Yes.
West.
Yes.
Davis. Mayor Roots.
Yes. Thank you, Madam Clerk.
You're welcome.
Excellent job. So So every quarter, every 90 days or so, our new emergency medical services team, company, organization, whatever you guys recognize yourselves as, saviors, ambulance company, VMSC. They have a presentation to give us an update, some stats, some figures, comments of how things are going, working with the city of Chester and serving us. Can't thank you enough for the work that you guys are doing.
Thank you. Again, my name is Shane Wheeler. I'm the CEO of VMSC Emergency Medical Services. Thank you for allowing us to make our 90-day report about where we've been and where we're going, right? We're, one, immensely proud of the service that we and the partnerships that we've forged in the past 90 days in Chester. It's phenomenal, right? The outpouring of appreciation and respect from the community to our teams has been, it's phenomenal, right? So really, thank you for just welcoming us into the community and trusting us with such a important mission. So, all right. So here, where we've been, right? So we met in late April, very impromptu, with the unexpected closure and shutdown of Crozier Hospital and the EMS operation, and rapidly, with about 10 days of preparation, stood up a EMS system, hired, 47 of folks from the Crozier EMS system, and, spent nearly $1 million to stand up the system here in Chester and Delaware County. Since that time, we've had many interactions and engagements, participation in events, and new innovations such as a blood program, and many opportunities to engage the citizens and the leadership here in Chester. So by the numbers, we've ran 2,187 calls over the 90-day period. Those calls resulted in about 66% of those those encounters actually being transported to the hospital, about nearly 11% that refused services, and a really astounding nearly 23% of our responses result in no patient at all. It's a real challenging operation with that. We have a lot of false medical alarm activations. We'll have reports of someone down in a community on a street and they're not there. So there's a lot of calls that tie up our resources where there's just not even a patient present, or unintentional activations of alarms and so forth. By the numbers there, you'll see the breakdown of the top EMS responses in Chester. Not surprisingly, sick person is a catch-all for many general complaints. Breathing problems, obviously not surprising for the environmental impacts on the respiratory disease crisis that has been occurring in this community for decades. So you can see there, trauma injuries accounted for about almost 5.5% or so of our total responses. So that's kind of by the numbers, as you can see what we've responded to. So I know that there was a publication that talked about response times in the county, and in fact, in the county perspective, their response times have increased to over 12%. But here in Chester, they're under 6 minutes. 5 minutes and 37 seconds is our average response time for emergency response in the city, and that's down from over 8 minutes in 2024. So you're getting service faster than anybody else in the county, and I think you're getting it better service than anybody else in the county. So, but I might be a little biased on that opinion. What is really profound to me is the impact on lives that we're having, right? right now in our operation, and we service nearly 20 municipalities across 3 counties, cardiac arrest survival in Chester outpaces every other one of our communities. It outpaces the Commonwealth on cardiac arrest survivals by more than double.
Say that again for the people in the back of the room.
For the people in the back of the room, you have a better chance of surviving a cardiac arrest in Chester than in most any place in the Commonwealth of Pennsylvania, right? So that is attributed not only to the fine work and skill of my EMTs and paramedics, but also the collaborations with our public safety partners, the police department, the fire department, right? The people in the streets that attend our CPR trainings and stop the bleed trainings, right? It's a community response that Chester itself should be very proud of, and that we're saving lives. 45% of the cardiac arrest patients we respond to arrive at the emergency room alive, right? Really a point of pride is the fact that Chester joins only an elite 1% of communities in the United States that has the capacity to do it has blood transfusion capabilities. And as such, since implementation about 2 months ago, we've administered it 4 times, right? Some of these you might expect are from acts of violence, some animal attack, right? That vicious animal bit somebody, right? And caused significant injury, right? Some self-inflicted injuries. But those people arrived to those hospitals alive because we were able to do blood transfusions in the field. My goal was simple when we came here. How do we take a community that just lost a trauma center in their backyard and give the people a fighting chance at survival? So we have invested heavily in innovation, in blood, in ventilators, advanced pharmaceutical formulary capabilities to ensure that we give every person every chance, however slight, that they can survive that ordeal. So really proud of the accomplishments we've been able to do with regards to our out-of-hospital cardiac arrest survival rates and our whole blood administration program that is truly making a difference for people in dire situations and giving them a fighting chance. But beyond the care, right, is the care. And when I say that, I'm talking about the experience that our community has with our fine clinicians, right? So every patient that we transport or that we interact with gets a survey. It's a text message that comes a few hours after the encounter, may go to a loved one or to the actual patient, and then they have the opportunity to engage and share in that experience that they had with our service. And our overall experience rate is 10 out of 10, and I'm just floored by that, right? You know, from compassionate care and their perceptions of kindness that they receive, 10, you know, and the communication between the clinician, the family, and the patient, 10, right? Understanding that they would recommend our services to others, 10, right? And mission impact, living our promise, one day, one call, and one life at a time, which is our mission statement, 9.75. So we're really proud of that. If you look at some of this things, some words that pop out on some of the select is safe, right? They made me feel safe. And in a community that has lost a trauma center, faces challenges every single day, the word safe is so important for the people who live here, right? So I'm proud that we can provide a level of safety for this community. We want to be part of the community. We are part of the community. Our providers live here, we work here, and many from the Crozier service that was here before have been involved with providing care in Chester for decades. My leadership in the room there, you know, a lot of experience there. But we want to engage. We were just recently at the back to school bashes. We've hosted community event days, the Peace Unity Walk. So we want to ingrain ourselves as part of the community. We recognize as your EMS provider and really the lead EMS healthcare entity in your community now, without a hospital, we have a responsibility to fill that gap, right? So you're going to see us out. We're trying to do new things and trying to be public. And, you know, we have some challenges for sure, but I think we're trying to fulfill that goal. But we do have challenges, right? We have barriers that are impacting our operations for sure. And there's a lot of things. We went into this with some assumptions based on data that may not have been completely accurate from the past, right? But we're managing it, and none so much that I feel are unsurmountable for us as a community to be able to mitigate and work through. The uninsured. Approximately 16% of our patients encounters are uninsured, which is in contrast to the current data that's available through the Commonwealth and the county especially, that says only 5% of your population is uninsured. We expect that this 16% is actually going to increase, particularly with the new administration's approach to Medicaid eligibility requirements that are going to attack this community, is going to feel this much worse than other communities and across the country because of the challenges associated with the economics here. This resulted in approximately $420,000 in uncollectible revenue in the past 90 days. It's a challenge, right? The collection rate in Chester is about 62%, about 13% off from the rest of our other operations in the organization. Medical alert alarm activations is a challenge for us. We have many buildings that have built-in medical alert systems that may not be properly maintained, are easily triggered, and they are accounting for responses that tie up ambulances every single day in this community, right? And we've had to try to find a solution to hold the owners of these facilities, particularly that I'm more concerned about, accountable for making sure that their medical alert systems, no different than a fire alarm system, are functioning properly so that it's not to tie up our ambulances on calls where there is no patient. Cancellations. Chester has about 33% refusal rate, and I think this is, and it's much higher than, twice as high as any other place. But this is a reluctance of care in many cases. The fear of being stranded at a hospital because there's not one just down the street. The fear that a loved one can't get to visit with them if they do get admitted, right? The fear of an unfamiliar clinician or unfamiliar hospital, right, keeps people from wanting to go to the hospital. We are working diligently. We just applied for a grant through WAWA to try to secure funding for a shuttle service that would provide transportation for family members and patients who may not meet requirements for ambulance transportation, but to get people back and forth from hospitals or wherever to get them the care that they need. So we're hopeful that we can raise funds to build a program that many people would like to go to the hospital to get their care, right? But they're afraid they're just going to get stuck there. So we're trying to find funding solutions that can arrange for transportation for people to get back and forth from receiving the care that they need. Because my fear associated with delay in this is where people with comorbidities like diabetes and hypertension that aren't getting the preventative care and follow-up from a primary care physician because they can't get an appointment with someone for 12 months in many cases, is only going to exacerbate and increase mortality rates in this community if we do not find solutions. We're committed to try to figure that out. Where many community members use Chester Crozier Medical Center as a point of routine care, utilizing the emergency room for things that probably could have been handled by a primary care physician, but unfortunately access to primary care physician isn't feasible, they use the emergency room. Now, without the emergency room, they're using the EMS system to fill those needs. We are happy to do the blood pressure checks. We are happy to do those things. But we are limited in our capacity clinically, we're not physicians, to be able to mitigate, make medication adjustments, the things that these patients desperately need, lab services, right, to follow up. And many of these folks are just not getting the care that they need. So This also creates a challenge for us. We want to do good, we want to continue, we do respond to these calls, but it is an uncompensated route, and it's an ineffective route for the patient because we just don't have the level of service capability to be able to do those things. I'm hopeful that we can secure funding in the future for grants to employ a community paramedicine, a telehealth operation here, to find ways to do that. But currently, there's no funding mechanism to meet those needs for this community. But I think it's a worthy cause, and I think if there are shining glimmers with the One Big Beautiful Bill Act, I use that term loosely, beautiful, it is the fact that it will drive innovation, particularly in the pre-hospital world, right? And it'll provide opportunities for us to do more for those with less. So I'm hopeful in the coming years that that will do that. But I'm afraid in the next 18 to 24 months, the impact of this act will be very difficult, very hard on this community and on communities across the United States. The other challenge that we had was our low subscription participation rate. We sent out our subscription membership program several weeks ago, and we've only had 51 people out of the 35,000 or so people that live here sign up for the subscription program. In fact, it did not even cover the cost of the mailer to do that. So that's a challenge to try to get people to invest in themselves, because this prevents balance billing. This allows us to shift taxpayer burden away from helping to support the system.
All right, hold on. Those are all big words. Make it real simple. What does the subscription buy a person who subscribes?
The subscription buys peace of mind, and you can buy it for your family, right? Because it's
And
not
how much
just,
is it?
So 70. And that's on the year, and that provides, if they need help, there's safety inspection that come out, we can do some things, right? But what that really provides is the balance bill surprise, right? So we've all got that where we went somewhere, got treatment, and then the bill starts showing up, right? The insurance only covered X amount of dollars, and then the balance gets paid, you have to pay a balance associated with that. Many insurance carriers under reimburse or have high copays associated with ambulance transportation. This removes that, because if you're a member, or your family is a member, then you don't get balance bill. We get whatever the insurance gets, and that's just how it is, right?
I'm sorry, can
sure,
I have
Counsel.
the amounts again? The amounts for the
Cost.
subscriptions? You went a little bit too fast.
Yeah, no problem. So it's $75 for an individual. It's $89 for a couple. If we define a couple as two people, so if a brother and sister live together or something, that would also count towards that. And a family is $125. And you don't have to live together to cover your family. And our subscriptions actually cover boundaries too. So even if you're in a different area and you have to be transported by an EMS, the ambulance is supported there.
And this is monthly, correct? Oh, yearly?
Yeah, it's a year. It's a year program, right? Yeah, it's 125 for the year, right? So let's basically, $10 a month, a cost of some of these coffees out there, right? That you could provide your family with this level of protection, right?
How do you get those subscriptions? You,
There was, about 3 weeks ago, maybe a month ago now, we
Right.
mailed to every household in the community. But we also send a few to the city here, but we can get like a stack for downstairs or somewhere.
okay.
It's also available on our website at vmscems.com. And then you can call, we're happy to help you with any of that. Stop at a conversation with some of our guys.
Say the website again.
Yeah, vmscems.com.
Thank you.
Thank you, Bryson. The other challenge is the reduced call volumes. We're some 2,000 responses less than 2024, which is huge, right? So we anticipated the volume of calls to be, transports to be somewhere around 7,500. Right now, it looks like our projections are showing just over 5,000, right? So those obviously impact, some of the challenges that we face too, because the volume isn't quite there to where we initially thought they would be. I share this because we want to start the next chapter. We want to talk about the next 90 days and beyond, right? You know, what are we doing? How do we sustain long-term success in our EMS operation in Chester? And what are we doing in the community to make it a better place from our perspective, what we can control, right? So our first request is it's time to start talking about that sustainability, long-term sustainability. We want to meet with the mayor and council and discuss what that looks like. A common sense, very transparent kind of approach. I've seen the fire department proposal. We've talked about this is much. I think the gap is very narrow, and I think we can get there together on this. So I just think that we need to talk about it. We need to explore, you know, municipal support. We need to support grants, partnerships, et cetera, and how we do that. We want to expand community access and care. This goal for us is to find ways to meet the patient's needs where they are. So how do we do that? Telehealth. How do we do that? Connecting people with PCPs, helping facilitate getting people to the right care they need. Not always an ambulance is the smartest mode of transportation, and certainly the emergency department in a distant city is not the solution either, right? So how do we fix that here? How do we drive that access for preventative care and do that? So we're committed to work with the city and the state and the county on how we find solutions to help people through that process. We're going to grow the workforce, right? We want to do EMT and advanced EMT training right here in this community, right? We want to give people, young folks particularly, the opportunity for a good job, right? To be able to work in their community, right? You know, it's no secret if you look at the guys, with the exception of Kate, of course, you know, a few of us, I'm not sure how many years we have left. There has to be someone to fill the bench. Who better to do that than our own youth that we can build up and mentor to do that? So, excuse me. So I'm excited that we're going to be starting EMT training here this fall and providing opportunities for folks to get into that training. Excuse me. Start talking and it starts itching, right? Advanced community health care programs, more access to information about management of chronic diseases, CPR training, et cetera. And something really important to me is ensuring equity in our care. I apologize. Oh, look at you. Thank you. That might help. This time of year, it gets me every time. Bear with me just a second. I know better. I should have brought some bottled water. I knew better than that. Anyway, equity of care is super important to me, right? And in a community that faces such inequity, right? So we really want to find ways to fix that, right? So it's super important for us to monitor how we deliver care and to identify avenues to create more equity for the people here in Chester. So I want to thank you for the time. I want to thank you for your time today. I look forward to continuing the conversation of how we continue to make Chester just a jewel in the community and in our state and in our nation as an example of what good EMS systems is. You don't have to settle for something less here, right? You're getting the very best here, and you don't have to settle for something less. And I'm proud of our nonprofit status because we're a nonprofit. It all goes back into our communities and back into our organization to provide this care. So I want to thank you again for your time, and I look forward to any questions you may have or our future conversations about how we continue to, now she brings it, right? How we continue to just build upon our successes. Thank you.
I do have a question. Well, first, I just want to thank you, especially for your community approach. I've never really seen a EMS service so active in the community, and I follow you guys on social media, and I see you guys not just in Chester, but all over the region, and how you guys really support the community and at community events, and you do community days. And I was also hospitalized 2 months ago, and your staff took extremely good care of me.
Excellent.
And so I want to thank you for that. However, as we look at the barriers and we look at the numbers of, you know, the $420,000 in uncollectibles and the 16.5% of all patient that is uninsured. And that number is only going to grow, especially, like you said, with the cuts coming from Washington. Have we looked at what that looks like long-term, especially for the city of Chester? And have we looked at what those numbers may look like and what, you know, Chester city government may have to, you know, start thinking about in our budget, or, you know, what that number may look like?
Yeah, I think with regards to, let's talk about the uninsured number first. I expect that number to double in many urban communities across the United States. The hardest hit will be urban and rural. Rural is facing a catastrophe, right, with hospital closures, and it's going to really impact. Urban will take the hit on eligibility requirements, right? And so I expect that number to double, to be perfectly honest with you. Why we have to act now to be more efficient in how we utilize the ambulance and address and still continue to meet the societal needs, addressing the social detriments to health, and how we get people access to care right now. Prevention is the key, and oftentimes in urban communities, there's a lack of trust in healthcare, right? And certainly with the impact that's happened here, right, that you've got to really question trust, and people just don't want to seek that. So what do I think that looks like for, I guess specifically the EMS is what you're asking?
Yeah, I want to know if you guys have thought about what that looks like long-term financially. Because if it's a burden on you guys, I'm sure at some point you're going to have to come back to the table, to the city, and say, hey, listen, we can't sustain this way. How do we, you know?
Well, we recognize a couple things, right? And we own some of the disparity. I'm transparent. The city said, when we met, we just want BLS. We want basic life support, right? That's what we're required to provide. That's what we need. We're not providing you basic life support. We're providing you the best that there is to provide, right? You're getting paramedics with a lot of life-saving capabilities, because our survival rate would not be what it is today without those paramedics. These people, when they receive blood, would not have survived their injuries, right? So this community desperately needs ALS service here. So that's part of our challenge with the funding, is that if we built the system the way you wanted me to build the system, it would have had really negative impacts to the survivability and added to the mortality. So we're building a system that I think is the most appropriate system for your community. Your people want every fighting chance they got, right? They need that, because you don't have a hospital anymore, right? So with that said, you know, and this is premature, and I don't want to, I'm not coming here, I think this is a dialogue that we have to establish, but, you know, we think the gap is, you know, at this point, somewhere in the neighborhood of, you know, $400,000 to $500,000 of contribution from the city to maintain the service, right? Which, if you look at other cities, if you go just down the road to Upper Darby, they have about a $500,000 similar service. They don't do the blood. They don't have a lot of those kind of capabilities. So I think it's somewhere in that. Now, we only have 90 days of data too, right? So we don't have a total picture of that. So this is that, you know, when we met, I said, listen, I need to really gather the data to really tell you what that is. But we'll be very transparent in that situation and just show you the numbers. And we work together to find solutions to do that. But I know the fire department's budget was well over 1.8 million or something, and that was for BLS service, and that was done in 2022. And that's when you had a hospital right here. The challenges that we have is that hospital wait times to tie up our ambulances, sometimes up to 5 hours, further transports into Wilmington and into Philadelphia that keep that up. So we're forging regional partnerships. We have Upland and Parkside that we're working very closely with, the neighbor Chester, and their numbers kind of offset, and they're helping to offset that minimally, but they're benefiting from some of that. So finding ways to forge partnerships with other municipalities to create more regional bank is super important. It's difficult.
And I would imagine, but I think we'll set up some kind of meeting so we can further discuss this and see what that looks like and see how we can come to an agreement. So
Thank you,
looking forward to
Councilman.
more dialogue with you.
Thank you,
you for presenting today. That we appreciate
Thank you,
it.
Councilman. I hope you're feeling
Thank you.
better.
We can get in touch with him at any time. Let's just move the meeting on. He gave his 90-day review. Thank you. Stick around after the meeting. It looks like we have a couple more questions from council.
Sure. Thanks, Mayor.
I just have a quick question about senior discounts for the subscriptions. That's it. Are there, I think your rates for the subscriptions are good, but for seniors, are there any?
All right, we'll discuss that after council meeting. Thank you.
I just want to put
Yeah,
that out.
Thank you very
Bryson
thank you
leads
very
that
much. Thank you
program,
very
you know.
much. You
I
did a
got you,
great
Mayor.
job.
Thank you,
Let's
Mayor.
move on. We have a group of young people today who came in, and they weren't scheduled to come in today, but we did talk earlier about having them here. And I know school's about to get started, so who brought the group in? Come on up, introduce them, and I know you have a little presentation for us. If you can be quick, that would be appreciated. But we also always want to respect the youth who take the time to come in and hear grown-up business here in the city of Chester.
Good morning, Mayor Roots.
Good morning.
And City Council. My name is Victor Cabral. I'm the Vision Actualization and Community Connection Specialist at Four Circles Beyond.
Victor,
Yes.
I don't want you to have to compete with the people in the audience.
I'll repeat it. Yep, no problem. So my name is Victor Cabral. I am the Vision Actualization and Community Connection Specialist at Four Circles Beyond, which is a nonprofit over at 2100 Providence Avenue. That's been providing summer programming for Chester youth for the past 7 years or so, and doing community work here for about the last 17 years. Part of my work this summer was to lead a group of youth, mostly from Chester, on a summer adventure where we traveled to Philadelphia, learned about the move bombing, got to eat lunch at the Honeysuckle restaurant. We also traveled to South Carolina, where we spent 5 days at the Penn Center, which is the first school for formerly enslaved West Africans in the States, as well as visiting the Tubman Museum, going to Savannah, Georgia, and spending some time there. And it was an incredible experience. I think I learned so much from the kids, and so I wanted to give them an opportunity to come and share with you all what they learned. We have some art that they created in a collage that we can put out in the hallway for folks to stop and look at after the meeting. But with that, I want to pass it to Kayla, who's going to be our first youth that's going to share about her experience. And then we have a couple more youth that want to share with you all what their experience was like. Thank you so much.
Thanks. All right, Kayla, you got to get that microphone right up to your mouth, and you got to be loud. We want to hear you.
Okay. Good morning, Mayor Roots, City Council members, and community leaders. My name is Kayla, and I'm 16 years old. I attended the PLA summer camp. I'm here today with my peers from Chester. This trip was more than just a summer program. It was an education in history, resilience, and leadership. We visited the Harriet Tubman Museum. After my visit to the Harriet Tubman Museum, I was inspired to write this letter to Harriet. Dear Harriet Tubman, hey girl, hey, thank you for being such an MVP. You deserve everything because you worked hard. You went through slavery, got free, came back, and helped so many people get to freedom. That's real queen stuff right there. You never gave up. You came up and did what you wanted to do. You put yourself at risk so many times just to get people free. Also, girl, you did that with no phone, no GPS, nothing. You did that with determination. You did that with determination, vibes, and courage. That's why we love you. You had everyone's back, and you was not the girl to mess with. Thank you, Harriet. We love you, Queen.
Good morning, Mayor, Roots, City Council members, and community leaders. My name is Bella. I'm 13 years old, and I attend the PLA summer camp. The ideas that were sparked in us and the things that we learned on this trip helped me realize that I don't have to wait. There are ways that I can make a difference, and I could do it right now. I learned about the MOVE bombing in Philly and how the kids in the community made a plaque so people would never forget. I learned about Harriet Tubman, who was in her 20s when she escaped the plantation. I learned about us, the kids that are making an effort to learn our history and are making a huge difference in the process. The potential of the kids in the city, the possibilities of what we could do are endless. We could do amazing things, create amazing change, and we don't need to wait on anything holding us back. We could make a change now, so why wait? Thank you.
Good morning, Mayor Roots and City Council members and community leaders. My name is Daenerys, and I'm 14 years old. The opportunity to travel with friends and create new friendships gave me a sense of true community. We stayed at the Penn Center where I felt a connection with my ancestors and learned how to basket weave. The visit to Morning Glory gave us a home-cooked meal and baked rosemary bread from scratch for us. And I also think that more kids from Chester should go to the summer camp, because in Chester there really isn't anything to do here in Chester, and not a lot of kids get the opportunity to go to different states or learn more about the outside world or even more about our ancestors.
Good morning, Mayor Roots, and City Council members and community leaders. My name is Aiden. I am 14 years old, and I am part of the PLA summer camp. So from my experience in this camp, I was able to have a different perspective over the courses of history I learned with the PLA summer group, because the information that we're being taught at school, like it's not like the entire story. And once we start like digging deeper into that kind of information, like once the opportunity to go to like different states and learn more about these people like Harriet Tubman, for example. And we went to the Harriet Tubman Museum in Georgia, and I learned a lot of very interesting information about that. We also went to the MOVE bombing site in Philadelphia, and I learned a lot of like political problems about that. And yeah, and I thought that was also pretty interesting. And I just want to say thank you to the staff members of the PLA summer group for giving us this opportunity, and I hope that even more people who would like to be part of the group as well. Thank you.
You can do it. Take your time.
That's all.
Good morning, everyone.
Good
My
morning.
name is Skylar. I'm 13 years old, and I will be talking about what I learned at the PLA Summer Adventures. We're proud to bring back what we learned from the PLA Summer Adventures, and we are committed to using it to help make Chester a safer place for the young people. Thank you for listening to our voices and for the work you did for our city.
That's what I'm talking about. That's Chester. That's our future. Our kids need to get out of here, take a trip, not to Dorney Park, Hershey Park, Dutch Wonderland. What else did I write down here? Atlantic City, Crystal Cave. Those are the places I went to summer camp. I didn't learn nothing about no Harriet Tubman. I didn't stay in no slave house. I didn't weave baskets. This is what we need to do with our kids. Thank you so much, bro.
Thank you.
Yeah, I just really quickly, I just want to say thank you to the youth for everything that they taught us as a staff on the trip. And I also want to thank the city of Chester and the parents who trusted us with their babies to make this happen. So thank you so much. We'll have some other art and the collage out in the hallway for folks that want to see it afterwards. Thank you.
Thank you. How can people
My name is
contribute?
Donna Davis. I'm with, I was one of the parents that sent my child to this camp. And I'm sorry, Councilman, but this whole experience was wonderful as a parent that attended Chester Upland School District. We did not learn what these kids learned in 8 days about our race, about Harriet Tubman, about Martin Luther King, about the movement up there, and that happened in 1985 when I graduated high school. This whole thing was wonderful for these 10 kids that got selected to go. And I want to thank Victor, because my child has been participating in this camp for 3 years, and they have never done anything like this before. He came in and wanted to teach the kids resistance. My daughter came back more mature than 13 years of school could ever do. Thank you, and thank you, Mayor and Council, for giving the kids the opportunity to come in here and talk about this today, because last night in my house was straight happiness. I had to work today. I had a mammogram today at 10 o'clock, but Kayla was so excited to come to the city of Chester and talk to Mayor and Council. I canceled my mammogram. I didn't go to work today. And I'm just so happy there's so many people in here to experience what these kids experienced those 10 days with Mr. Victor. Thank you.
Really quickly, I just want to say thank you. Thank you so much for teaching these young people this. And this is what we need. We need more of this. This is what the city needs, and this is how we're going to turn this city around, with young people like that taking the lead. And to the young people, continue to learn. Learn, learn, learn. Learn as much as you can. Learn the history. And when you learn the history, teach it to someone else. That's how we're going to continue this. So keep up the great work, keep learning, keep striving, and keep being the great leaders that we know you can be. God bless you. And they want to know how can they contribute? How can someone contribute to this program?
Get a microphone, please.
You can visit our website, fourcirclesbeyond.org. That's 4 as the number 4, circlesbeyond.org. I can send that information as well to council and the mayor afterwards. And yeah, we take ongoing contributions, and we're already starting to discuss next year's trip and what we want to do for the kids throughout the year. So having more trips throughout the year that we can do over the weekend or things of that nature. So any contributions you can make via our website, and I will happily share that information with council and the mayor so that it can be disseminated via email or on the app that was just launched not too long ago. So
thank you. Thank you so much.
Can you tell us the ages that your program will accept children?
Yeah, so this particular program was for youth 13 to 16 years old, but the programming that we're planning to do throughout the year is going to be open. For this particular trip, we just wanted to make sure that the maturity level was, we didn't have, an 18-year-old and a 13-year-old might not, connect. So, but with the programming that we're doing in the community, we're just looking to engage with youth at all ages, as we talk more about what we're going to develop this year, we'll have more of an idea of what the appropriateness for ages and whatnot that we'll be able to offer.
Thank you.
Thank you.
All right, we're breaking all the rules today. So much so that I just want to hit this gavel. Public comment can wait until another day, but we don't do that. So it's time for public comment. Let's start with Ricketts Robinson. 3 minutes.
Good morning, Mayor and Council. The reason why I'm over here, I just see 1100 block and 1130 on Morton Avenue. It's that field that's across the street from my house. Could you please come cut that grass? We got possums running all over there. A little old lady that lives across from there, possums got her and she fell down. And she fell down because of the possums. Then in the back of me, 1037, it's a tree falling down. It fell down, some of the branches, but the person that owned the house, we clean the alley up, me and my neighbors. I catch a bus on Higher Street. The grass, the homeowner, they don't cut the grass. I got fined 1 year for some vines that wasn't even on my fence. My yard is cement. The guy came, counted the houses. When he came back, oh, I got the wrong house. I mean, it's vines. I keep my grass cut, front and back. But it's vines all in the back. Nobody came and said nothing to them. They was gonna fine me $50. But my son did investigation. Mom, you ain't gonna pay that because you don't have no vines. But like I said, I'm getting ready to have a barbecue for Labor Day. I gotta go back there and clean up the alley. That alley wasn't never like that when I first moved there. Then we have a problem at 1027. The woman got dogs, 3. One dog attacked a little boy that lived a door away from me. He attacked him. The little girl comes out, my neighbor's sitting outside. She said, excuse me, is your dog pooping? She looked at it and said, oh, I'll be back. We stayed outside till 10 o'clock. She never came back to clean it up. And when I go out to go to church, so I won't take it in my sister's car. And I think it's ridiculous that you can let your animals just run up and down the street and just let your dog do its business. I thought it was an ordinance that you have paper towels in a bag. But they don't. And I think it's horrible. Thank you.
Thank you. S.J. Dennis.
Good morning, Mayor Roots and council and community members. My question is about I know PECO is now doing the streets. They're putting in new pipes. PECO. I was just wondering who's going to repair the streets, repave those streets? Are we responsible for that, or is PECO responsible for that? That's number one. Number two, the parking authority. You were having a meeting on August the 4th, and I was just wondering what the outcome was with that. If Widener is going to start paying, since they started removing they have removed all of the poles that were put there from the previous parking authority. So I was wondering what was happening with that. Also with the parking authority, now, you know, seniors don't know about apps. Most of them don't even have a phone. They still have the flip phones, so they don't know anything about an app for parking. So how are they supposed to scan and do all this? They don't know anything about that. So I was wondering, how are they supposed to pay if they're parking? And then my last thing is about Deshawn, an update on that.
Okay, you can have a seat, and
All
I'll
right.
address a couple of those.
Thank you so much. And I did it.
The Central Business District is having gas mains put in. The gas mains are in the street. Of course, they had to dig and then temporarily pave, is that the right word? Yeah, patch and pave. Still a little rough out there in the places where they put the pipe. We had PECO here yesterday, so your question is very fresh on my mind with the answers. Yeah, so we had PECO to speak to the business community yesterday because they wanted some updates on what was going on in front of their businesses. There's still a lot of work to be done, although the new main is installed. They have to put gas in that new main. Once gas is in that new main, every building in the downtown area that's serviced with natural gas has to get a new service line installed. So there'll be more digging. Every place that's open right now, they will be digging a trench in front of it, connecting a pipe from the meter to the new main. So that work has to get done. And then when it's all over, to answer your question, PECO has, you know, contracted folks that's going to finally pave the streets and fix the sidewalks in the places that has to be done. Let's see, parking management meeting on August 4th. What was discussed was a particular neighborhood that probably no longer requires residential parking permits, but there's some other things that came up in that meeting. So probably by the time we get to our next council meeting, is that what we anticipate, our next council meeting, there will be a resolution to make some adjustments to what the Parking Management Authority is doing. I don't know what's going on up at Widener, you know, as far as polls are concerned. And Deshawn update, that's an update we'd have to get from Delaware County. I know they put out a request for whatever the last letter is for people to submit ideas as to what they would do with that nearly 20-acre site. So I will, I think the bids are closed. Did they come in? Do you know, Tom?
The bids
for? Deshawn at the county.
It wasn't as much of a bid as a request for proposals.
I mean, a request for proposal,
Yeah,
yes.
So
That's closed now?
That was closed, so I think the county's reviewing that.
Yeah. All right. You're welcome. Mr. Nasir Jihad. Chihuahua Scouts.
Good morning, Mayor, City Council,
Good morning.
Chester community, and those that's visiting. You know, first and foremost, I want to thank the pastor for that beautiful opening this morning. And you know, when I look around, a couple things came to mind. Young man. Just as we talk about these youth, you already know I'm about the youth. And just as we all see and said, this is our future. We got to keep working behind them. The good ones and the bad ones. Keep working on the bad ones too. Maybe they might get it, you know. I wanted to talk about, which I see it's on the flyer, just to bring up, this is a community event that we having, a fishing event. I know you've been down before for the city of Chester, and I see y'all have it on the flyer, which is good. I went down, the grass was cut. We ready to get our rides over the fence this year. So I just want to really thank everyone, city council. Hopefully the community come out and we enjoy the day. Looking for some good weather. Everything is free, and we encourage, bring your children out, bring the youth out. Fishing is a part of things. Always one thing, do for self, feed yourself. So I wanted to do that, and I wanted to take time to thank the commissioner for helping me, the police commissioner for helping me with the situation. Man, I thank all of y'all. I appreciate it, and last thing I want to say. For these meetings, the room is crowded, and I encourage everybody to bring somebody. Everybody bring somebody, because it's going to take us. And when I say us, I'm talking about the city of Chester. Everybody. Let's keep working. Thank you.
Miss Livia Smith.
Good morning.
Good
to
morning.
everyone.
Morning.
I just want to bring up two community issues. The stop sign is missing on 18th and Washington Boulevard, especially the one that comes down 18th Street. It's a dead end. Widener's getting ready to come back, and they fly down that street. It's a one-way street, but nevertheless, a stop sign was there. It needs to come back. Secondly, I noticed, the ramp off of Melrose Avenue, the I-95 ramp, it is full of trash. Full of trash. I don't know whose responsibility it is, but someone from L&I or somebody's department need to take a look at that. It's very embarrassing when people come in and see the magnitude of trash. And it's probably on some other ramps, but I just happened to notice that one because the bridge is out, because they're fixing the bridge, and I have to go around to do, okay, it must be open as of today, because yesterday wasn't open. All right, lastly, because the time is flying, I want the council to look at the authority board, section 5610, municipal authorities, PA 2016. I'm just going to read one part of it about terms. As you know, there is a vacancy on the Stormwater Board, and it says the municipal governing body appoints a member for the term of 5 years from the date of the expiration of the prior term. Appointments cannot be made by a municipality until the vacancy actually exists. In other words, until existing member's term has expired. That vacancy is there, requesting that the city council appoint a person to that board so the board can be made whole. But I need you to look, there's some other interesting things in this particular document. You need to get a copy of it. Your solicitor needs to provide that to you so you could be on board, because the council appoints all the boards, and they're responsible to make sure everything is in place. There's some things they failed to do, and as far as the legal part of it, and so I want to make sure when you go through this next round that everything is correct. Thank you.
Could you repeat that code that you?
The code is the title is the Authority Board, section 5610, Municipal Authorities, PA 2016.
Thank you.
Okay, and you can read it in its entirety.
And Ms. Smith, in reference to that, I literally just had a conversation last night, me and Tom, in reference to that, and I'm going to be speaking to council and the receiver to see if we can get that on the next council agenda moving forward. So if so, you'll hear about it.
Ms. Smith, I wanted to respond in regards to our highway entrances and the cleanup. So right now, our Public Works Department has been cleaning those highway entrances consistently. However, it is a PennDOT responsibility to clean all entrances and exits of ramps for highway. So we've been trying to develop a strong relationship with PennDOT so they can be more consistent with cleaning that, because it does look atrocious. However, the city has been taking full responsibility of that, but it is not the city's responsibility to do so. It is PennDOT, so we're working with PennDOT to, get that done in a, more consistent manner.
But the city, on behalf of the citizens, should reach out, as you stated, to PennDOT, and make PennDOT do what PennDOT is supposed to do.
Yes, ma'am.
Because in other communities, PennDOT makes sure that their ramps are good. And we know we have no McDonald's here, we have a Burger King here, and all that trash comes from those establishments that people just dump. Because again, there is a school, somebody in a school, on one of the ramps. Now, I mean, come on.
Mr. Jamil Cotman.
Thank you very much, Council.
You're welcome.
Good morning, Mayor. Good morning, Council.
Good morning.
I'm coming here on behalf of Walnut Street Deli, thanking the city, the community as a whole for allowing us to do the summer food program this year. It was a success this year, and I would like to give flowers to Mark Alexander, Quan, Tanya, the receiver. I would like to thank everyone for making everything a success that we had set for 3,000 meals, and we went twice that much this year, feeding the kids. I'm happy, I'm hoping that next year y'all will bring me back again and continue to do the same exact thing. We was taught that in school, no child left behind. Guess what? There was no food left behind this year. And we're happy that we can feed every child who's out there. Thank y'all, and God bless.
I'll make a little comment on his comment. I did visit all the locations that the summer food program was taking place this year. And to your credit, Mr. Cotman, I will tell you publicly that they loved the food. They absolutely did. So that's number one. Number two, let's make a short correction. We didn't allow you to do the program. You bid. You're a businessman. You put in a bid and you won. You were a sole, respondent, so you're automatically going to win. But the fact that you bid means you're about your business. And we need more people like you who understand that process and, we want to do business with local businesses. So congratulations. This year, you served our kids very well. Thank you so much. I appreciate it. Uh-oh, he's back. He probably had a couple seconds left, so he can go ahead.
By the way, this Friday at 2 o'clock, we will be having our employee appreciation day. What we got to learn is we got to always give back to your employees. You don't know what employee is beneficial to you if they leave today or they're not. So please always give back to your employees. 2 o'clock, I invite council, mayor and council downstairs. It will be a catered for the employees. Please come down and see who worked for y'all this year. Thank y'all.
Thank you.
Ms. Alethea Freeman.
Tired. Good morning, everyone.
Good morning.
Okay, first I wanted to thank you, Mayor, for allowing me to be on the Chester Housing Authority. I have learned a lot of things. I'm going to different places. I know I wasn't your pick to be the chair, but I'm glad that you allowed me to stay there. also, I need someone to look at that property for the grass and the vines. It's really bad. It's over there at 1004 Tillman Street. Like the lady said, people are being fined, but the wrong people are being fined because it's not their grass. It's great big trees. I don't know. I've never seen nothing like it. It looks like a jungle, and it's over in the other person's property. Third actually, to Tamika. You can cook. It ain't nothing, you thank you for what you do for the people every week, every Sunday. Very good job. And I think that's it for me for today.
All right, thank you. Let's just make one thing clear. We mayor and council, appoint members to the Chester Housing Authority Board. What you do as a board is up to you, so it's the board who chose the chairperson. I had nothing to do with that, no say in that. That's the board's decision. Congratulations on being the board chair. Robin Freeman.
Thank you.
Good morning, Mayor and Council and Chester residents.
Good morning.
My name is Robin M. Freeman. I just wanted to reiterate to you, Mayor, about the fundraiser we're having this weekend for the 3 residents in Wellington Ridge that were Crozer Chester Medical Center employees. And also we have included Nyleek, the little boy who has gotten hit by the car. I just wanted to tell you, or asked, which I gave that already downstairs, the application for the street blocks, the streets being blocked. I know the application does say that no police present, we're not responsible for police presence, but I know that's 28B, and as I always knew, they always get police presence. I don't know if you changed that or not, but Highland Gardens always does. So I'm just asking for that. And also, I don't know who owns Rite Aid.
Rite Aid.
Rite Aid, the parking lot. Oh, yeah, Rite Aid. But we want to park in the parking lot and walk up.
I mean,
You don't think you have a problem with that?
I'm not going to answer for Rite Aid.
Well, everybody else parked there. They working on cars and everything else there. So I don't think it'd be a problem.
We're not going to move you.
Okay. All right. Thank you. And lastly, I want you as mayor to talk with the Commissioner Blackwell. I just updated her on some information about some press conferences we have coming up in the city, and I just want you to know about it. Thank you much.
Okay, thanks. Victor, did you want to come back up, or you would just?
I had just jotted my name down, but I would like to get a picture with everyone.
Oh, sure, we can do that afterwards. Y'all hear that? We're gonna take a picture with the group afterwards. Who's left? We've got the big 2, our favorite closers. I feel like a Phillies baseball manager right now. I'm gonna bring up Brown Williams.
Those 2 are excellent. They can speak in a bit.
They delivered for the paper to sign, but they couldn't sign it.
All right, listen, this is
Y'all
what we have to do.
disappeared.
Let's repeat the rules, although we broke a
All
lot of
right.
them today.
The paper's supposed to be right at the time that took me. You get
The
me
meeting
up-
starts at 10. Get here a little early, sign the sheet, okay?
That sounds beautiful.
I saw you sneak up here. Come on, let's go. What you got?
I
You
ain't
got
sneak-
2
I don't
minutes,
sneak.
55 seconds.
Well, it don't make no difference. You don't give me up to 10 seconds. I
Every
ain't got
pitcher,
too much to
there's
say
a
today.
pitchers have a pitch count now.
On Curlin Street, on Curlin Street. Right there as you walk on the railroad track, a big limb hanging up that tree. That limb gonna drop on somebody sooner or later. Y'all got workers. Tell them to go up there and pull that limb out of there.
You tell them. There they go.
You tell them, you the boss.
You tell them. You
Yeah.
don't have to wait
Who
to
the
come to
boss
city
is out
council
for the
to
limb?
talk about limbs that are falling.
Yeah.
Which
But
underpass on Curlin, you have them,
I see it.
Missing stop signs. You don't have to wait till council meetings for
All
this.
overtime. Oh, you got to go there and take that limb out that tree. Time you walk on the railroad track.
It's on the railroad track. That's not our
I
property.
say under the railroad track. I say under the railroad track. Time you walk under that.
Okay.
Now, the next thing I got to tell y'all, the other day, all them kids standing up in that creek down there. I'm letting y'all know, too. I tell the water people yesterday, some of them damn kids gonna drown.
What
Because they've been
creek
out
are-
there on that, it's a long bridge, a black bridge. I didn't know that bridge was in there. Them kids were out there on that bridge, that day. Sooner or later, they gonna jump over. And something will happen, somebody's children will be drowned, our grandkids. I'm letting you know before it happens.
What would you like to do about that? You have any solutions, or you
Yeah,
just?
you need to put a fence up there and a gate up there where they can't get in
All
there.
right. So we're talking about the stormwater retention pond. So shouldn't you be talking to the stormwater authority
Well, I
about?
talked to them yesterday, but I'm letting you know, you the head of the man.
That's their project.
You the mayor, you supposed to talk
All
to the
right.
mayor.
Well, what did they tell you yesterday? That they're going to put a
Well,
fence up?
ain't none of them say nothing.
Oh, okay.
Yeah.
So you want to use your taxpayer dollars?
I don't care what they use, they're using it anyway.
Okay.
Trump's sending a lot of overseas.
What else you got? You got 50 seconds.
And I don't care if I ain't got but 10 seconds. Now, the next thing I want to tell you, we need a lot of things cleaned up. All these abandoned house, grass in the yard that high. Even 26, 28, grass in the yard that high. You go down there on Holland Avenue where they fixing up that old raggedy house. They must build a garage down there on the corner by me and make it where the water can't must run to the drain. There's a lot of things going on in Chester need to be cleaned up, doctor. Now, you take the, up here by these sign where you got to tap your phone, I don't care phone. The park, that's a disgrace. That they called me in 1973 when a lot of people leave Chester. I ain't buy pants or socks or nothing in Chester. Sam, a little lady, this be a little white lady. This is mark your thing with a yellow key up. If you didn't turn it over so right, she'll put a little ticket on there. So now that doesn't come back here in Chester again. You don't need that in Chester. You need to get Chester where people come back in and start spending money. You know, in 1965, you couldn't get through right through here on Friday night and Thursday night and Saturday evening till 6 o'clock. It used to close down.
10 seconds.
At 6 o'clock. You can have it back.
Thank you, sir.
And have a nice day, and may God bless you if you do the right thing.
You know, if you heard Mr. Brown, clearly he's asking the city to take care of a limb that is probably on the train tracks property, to deal with other people's houses who have overgrown grass. And there was one other I didn't write down. But each of the things that he asked is not unreasonable. It does represent, if addressed, the beautification of Chester. But what many people fail to realize is that the work that he's asking the city to do is not on city properties. Okay. We've estimated that up to 60% of the work that our public works guys do, and it's all guys, I'm not trying to be sexist here, is on other people's properties, whether it's picking up trash on a highway entry or exit, whether it's illegal dumping in a park, a back alley, whether it's high grass next to Miss Johnson and Miss Willis's house, whether it's a tree that's going over your fence line, falls down, breaks your fence. I mean, we can go on and on and on. It's easy to come in here and, you know, address mayor and council with those issues, that if addressed, would make the city look a lot better. But when you see our public works guys on the street, and you see them now, they wear Dayglow t-shirts and vests, and they look very official. Go talk to them, because you're not going to be talking to them sitting in the park eating a water ice. You're going to be talking to them, disturbing them, picking up somebody else's trash, cutting somebody else's grass. That's what they do all day long, every day of the week. Every summer we have to hire nearly a dozen, what do we call them, per diems, just to try to get it done. Every summer we have just as many lawnmowers, and I know I'm preaching to the choir right here next to me. Every summer we have lawnmowers, and just as many are in the repair shop than they are out doing the job, because they're, as one so eloquently says, they're not cutting golf courses. You know, when weeds get high, you don't know what's in those weeds: pipes, rocks, bottles, guns, whatever. It's not a thankless job, because I thank those guys every day. If we had the money, we'd have 3 times as many public works people cutting other people's grass, picking up other people's trash, and taking care of things that don't belong to us. If we were selfish as a city and only took care of city property, stuff that we owned, the city would look horrible, more than it does right now. You know, bear with us, have patience with us. Go out and thank those public work guys, because when you see them, they're going to be working. I guarantee you that. Who are you? Introduce yourself, because you got to add you to the list here.
Okay.
We don't take many walk-ups, but we broke all the rules today. Why not keep going?
I'm truly sorry, and I appreciate it. My name is Leroy Wesley.
Leroy Wesley.
So good morning to you, Honorable.
Address.
420 Jeffrey Street.
You got 3 minutes. Go.
So, good morning to you, Honorable Mayor Roots, Council, and city members. I am new to the city of Chester.
Welcome. Where you from?
I'm actually from Sharon Hill.
Okay.
Me and my little brother own and operate a auto body and towing company on 420 Jeffrey Street. Sorry that we're just coming to introduce ourselves, and also I want to apologize for, you know, any confusion of us trying to get settled in the city. We are a company that has been like growing tremendously. We have excellent body techs, and people come from all over to get their cars repaired by us because they like the quality of our work. But I came today not to talk about the shop, but I came today because I wanted to give back to the community, which we usually do every year for the kids. We wanted to do a backpack giveaway, try to give between 100 to 200 backpacks to the community, and we just wanted to figure out what's the process. I tried to reach out to Council West a few times. I'm not sure if you got the emails or the voicemail messages. But, you know, we just wanted to see how we can give back to the community. One of the biggest things that I wanted to work on, because I know you may not own down by the waterfront near the Soccer Arena Stadium, but I wanted to try to do a car show. Not like a car meet where people are like, you know, burning tires, messing the roads up, but actually have celebrities like Little Uzi Vert that's into, you know, into a lot of exotic cars and stuff. And then I have a couple friends of mine that I played football with when I was at Temple that have exotic cars and that, you know, are willing to come down, speak to the community, and then do a donation back to the community, whether it be the nonprofit program or, you know, anything like that. I would like to allow it to go back to that. But that would be for something to talk about for next summer. But as of now, today, I wanted to see what we had to do to give the book bags out to the kids. I just didn't want to just, you know, start handing stuff out without coming to you guys and getting the okay with that.
So my knee-jerk answer is just start giving stuff out.
Okay.
Do your thing. However,
All right.
you're new in town. There's
Yeah.
a lot of book bag giveaways, and I
Okay.
would encourage you to
Connect.
to
Okay.
connect with one of the others.
Okay.
Council Lady Gibson, would you take that on?
I sure will.
See?
Okay. All right. And if we could, that would probably make it a lot easier on us as we're busy ourselves. If we could partner with someone, whether it be us just giving them bags or helping them hand them out as well. If you guys ever need anything, like I said, my name is Leroy. My younger brother is only 21, but he's trying his best. As you know, youth is, it takes a village to raise, young men and kings. So I truly appreciate the patience with us, and I'm always, available for anything.
And I would also encourage you to speak with Crystal Burrell. She
Okay.
is our recreation coordinator, and she handles a lot of the events
Okay.
in the city. And
Okay.
she's also really big in the community, and she plans a lot of events, and she works with a lot of people that's doing back-to-school book bag giveaways and stuff
Okay.
like that. So maybe connect with her, and like I said, Councilwoman Gibson.
Okay.
And those two are the perfect resources to do something like that. And
Okay.
Crystal is in office today, so speak with
Okay.
her before you leave.
Okay, and what's the
see if-
last name again? I'm
Crystal Burrell,
Burrell.
Parks and
Okay.
Recreation.
Okay, all
Yeah.
right.
Thank you for coming.
Yeah, thank you.
And, because I know it just takes so much to come up and talk about your businesses, and I can
Yeah.
see you're a little nervous, right?
No, it's just, I haven't spoken in a while. I have a degree in neuroscience, so I've been out of.
That's why he's fixing cars.
Yeah, yeah, actually, the brain, the body, believe it or not, I'm still thinking about doing surgery, but the body and the car is the same thing. The brain is the engine. The tires, the front and back tires are your arms and your legs.
Yeah.
So,
I was just having that same discussion with somebody the other day.
Yeah.
Thank
so,
you.
Thank you to you guys.
I'm gonna
and
come
God
down to
bless.
visit you guys.
Okay.
I think the council lady has one comment or question.
Yeah. Okay. All right.
First of all, let me apologize. I didn't get your email.
Okay.
Okay, or your messages, because I certainly would have gotten back to you.
Okay.
And I'm going to donate some book bags to your effort.
Okay.
You'll get them you don't know when you're going to.
No, I don't know when. I just wanted to get an okay, so I wanted to at least do it in the next 2 weeks. I was going to put the order in, and I should get it in like a week or so and try to
Okay.
get flyers made to hand out. I know that I've been seeing the youth kids walk, like the little younger kids walk into the. Sorry, I'm starting to learn the area, but the little park around the corner where I guess where they practice at for football and stuff.
Yeah.
Yeah, so I'm going to go around
Memorial
there.
Park?
Yeah. So I'm going to go around there and like hand stuff out to the parents and stuff like that. I was going to start there. I didn't want to put nothing in nobody's mailbox. I didn't want to get in trouble.
Like the mayor said, if you get with Crystal Burrell, she can help you with,
Okay.
maybe setting up in the park or something like that to give out the book
Yes.
bags.
Okay.
Okay.
All right. Thank you guys.
I'll drop them off to your shop.
Okay. If I'm not there, the secretary or my brother.
Okay.
Yeah. Okay.
All right.
All right. Thank you. I don't have any other.
Hey, Mr. Salim, it's your turn. Close us out.
All right.
Yes. Good morning, sir.
Good morning.
You really caught me a bit off. I wasn't expecting, but good. I'd like to share with you very briefly. My name is Amin Abdul Salim. I live at 240 Patterson Street in Chester here. Yes. The development, if you will, intelligent development that is coming upon us gradually. As God said, He's going to cause this to happen gradually. He said to strengthen the heart. Because if you was in lies, and if you will, sir, and your heart's weakened, going to get weak. So God is bringing us into truth, and He said gradually to strengthen the heart. So this is good. This is what, but we certainly do not want to go too quick because it's no good. It is no good. I like to, and certainly we do appreciate all the work and the sincere work, the way of sincerity, all the work, the sincere work that the ambulance, the people of the medical, profession are doing for the city of Chester. We certainly appreciate that. And we want to say to you to continue coming sincerely, because it's easy to turn back. wrong, and so forth. And we're moving this city, if you will, this town, and this world, serious, sincere. We're moving it straight, straight to our Lord. So if you want to come right, as they say. Again, this is the beginning. I know there's quite a bit have been said. And there's some things that gonna have to be unsaid in order to put it right. So that's what we wanted to do. We want to put these things right so that we can go with these things on to our Lord. Cultural development. Cultural development is a people, but this is down the road here. I don't need to say this. I don't want to say this. But we have made some great advancement that I've noticed, great advancement. We want to keep on making a great advancement. It says here, if you will, sir, Imam Walter D. Muhammad, sir, if I may share with you, he said, life is the final battlefield. Life that God wanted, the life that I'm talking about, the life, not just any kind of life, life that God wants, the life, proper everything. He said life is the final battlefield. In closing, sir, I also like to congratulate the man who opened with the prayer. I see that he did not, go too extreme about mentioning Jesus. He mentioned God and the Creator, I think. And those are good things. The forefathers, they mentioned, if you will, sir, it said, the expression goes, go west, young man, go west. So they mentioned, they saying in essence, go west, go over the east here with all of the people where Jesus walked, Abraham, all of them, Muhammad, and Moses, all of them walked there. Go over there, go west, young man, go with the moral values that we have taught you. Don't go over there with this raggedy stuff, this other stuff, excuse my expression. It said, go west. But they went over there, if you will, sir, if I may.
10 seconds, sir.
Yes. They went over there, not as their forefather told them. This is something in itself, and it's going to take more than 10 seconds. But they went over there, and young whippersnappers, if you will, and that's a word. They went over there, and they got, everything was quick and whippersnapper, quick. They wanted them to go over there in peace, in sincerity, patience, dealing with what's over there.
Close us out.
And these two are brothers of one another, the West and the East. Sir, I appreciate it. I will stop there. This is another time. But this is a good meeting. Inshallah, we want to shorten it to the sincerity of life, the most important thing, sir.
Thank you, Mr. Salim.
Thank you much, sir.
All right. Closing comments from council. All right, go ahead. Get the microphone.
I didn't want to talk. Lord, brother.
Brother, I mean, they go to prayer 5 times out of 7 days a week. Often. He's not good at public speaking, but his heart is good.
Mm-hmm.
When we sit around, even I probably be married almost every day. I got to go up and back and figure out. By the time I get back, I might figure out half the stuff we talk about. But his heart is good.
Mayor.
So I'm just saying, listen with attention.
Okay. So speak for your own self, brother. Speak for your own self. They would not allow me to speak, make comment because they are not where I'm at with this. So, inshallah, astaghfirullah, I'm sorry, sir.
On that note, yeah, I'm not going to try to follow Mr. Salim, but on that note, I just wanted to give our youth a congratulations.
Yes.
Y'all did an amazing job. I want to particularly hit on something that I noticed, the camaraderie and the teamwork that you all had when your fellow camp member came up to speak was awesome. And that's what we're talking about we need here in the community. We need each other to uplift each other. The support, the unity that you all demonstrated today speaks volumes, and it's going to show in our community. So I just want to let y'all know that I'm super proud of you all. I'm amazed that you all got an opportunity to learn and travel. That's what we want. And we're in full support of anything that you're trying to do in the future. Kayla, I'm going to call you because, you know, she's my god sister, everybody, so don't take that crazy. But I just want to say that I'm extremely proud of you. I'm extremely proud of the leadership, the parents that were involved. It takes a village, and a positive village at that, to, you know, spread positivity and love. So I just wanted to give you all your flowers and say that you're doing an amazing job.
I too would like to piggyback off of that and just thank our youth for your presentations that you made this morning. They were wonderful. Kayla, let me tell you, you've been the apple of your mother's eye. Look, we knew you before you were even born. And so, Donna, great job. And to all of the parents who have supported the young people here, congratulations. And to the advisors, thank you so much for your work. I hear people say a lot that there's nothing for the children to do in Chester, but there are lots of opportunities here in the city of Chester for children. You just have to go out and see them. When I go through the parks and I see the camps that are in some of our parks, you know, during this summer food program, there are a lot of opportunities for our kids. Parents, we just have to seek it out. Just go look for things that are happening in Chester. There's a lot going on in Chester. So we need to stop saying that, and we need to stop downplaying our city. To the EMS services, thank you so much. I do feel more comfortable having you around, and I'm glad to know that you have subscriptions. We do need to support you, and it's really supporting us, you know. So I want to encourage everyone who can, you know, to get a subscription to help defray some of the costs. And community leaders, I want to thank you for your participation in what you do here in our city. We have a lot of entities that are doing things. Our local 413, they're always out here doing things for our people in the community. And I want to thank you too, you know. It's good to know that you have our back, you know. So thank you. And Mr. Salim is my classmate. And let me tell you, I always listen to what he has to say. He's a gentleman, and he's a community supporter, and I really appreciate your being here every council meeting. He's here every council meeting. So thank you. I appreciate it.
I think the new word of the day is speak for yourself. I want to just thank each and every one of you for coming, and thank you to the youth for sitting through this 2-hour meeting. I know it's not easy. And also thank you guys for speaking. It's not easy to get in front of a crowd or get in front of people and speak, but you guys did an amazing job, so continue that. And I again want to thank the Chester Water Authority for presenting this check for the Peace, Love, and Unity Festival. And also thanks to our local 413. They was one of our first sponsors for the festival too. So, and also as a reminder, vendor applications are still being accepted for the festival. And we look forward to seeing you on September 13th. And also, Mr. Chair Lady, you said it earlier in reference to Councilwoman's cooking. I had a chance to go to her event on Sunday. Every Sunday, and Councilwoman is amazing. Every Sunday, she feeds the community. She cooks out in front of her house with her whole family is there, and everyone's cooking, and they're giving out all kinds of watermelon, free food, and people from every which direction was coming there on Sunday. And I appreciate the work that you do in this community. And oftentimes we wait till someone dies to give them their flowers. And so I want to give you your flowers today and say, continue the work that God has placed in your heart to do, because that is truly your ministry, is giving food and really talking to the people and serving the people. And so thank you, and continue that great work, and continue frying that fish, because it was good.
Let me say this. I love the city of Chester and everybody in it. I don't care about race. I don't care about religion. I care about the whole person. And it is an honor and a privilege to serve our community. No mother could ever imagine getting a phone call that her son had been stabbed. You guys helped save my son's life. He only needed a few stitches. I don't like the distance that it took to get him to receive help, but everything he needed, you guys had, and I can say my son is alive and well. So I applaud you for helping. That's my baby boy. All right. The next thing I wanted to say is that there is going to be a back-to-school event on August the 23rd from 10 to 2, and our most famous Philadelphia Eagles, N'Kobe Dean, and his organization will be here, along with tips from Philadelphia. If you guys have not had an opportunity to register your children and you need assistance, please let me know so that I can get your children registered. And what else? Oh, and on the 28th, Tucker Rocky. Who knows Tucker Rocky from Legacy Arts? The man is amazing, and he is concerned about beautifying the city of Chester, ridding it of its blight. And he's doing my building at 1603 Concord Avenue as we speak. He involved the entire community to take part. And if any of you remember when I ran, I said inclusion is everything. You have to include everyone in the community. And I just love what he's doing. And so I invite you out on the 28th at 5:30 to 7:30 to celebrate this monumental moment at 1603, where my nonprofit Stepping Up Mentoring is housed. I thank the volunteers that come out, Ms. Bonita and several others that come out and help serve our community. You truly have a servant's heart. And y'all, I don't like doing dishes, but she does. And every Tuesday at 10 o'clock, if you need fresh produce, you can come and get it at the same location, 1603. And again on Sundays at 3 o'clock, that's when it goes down. You guys can come and get a meal, because I know it's hard, you know, and some parents just don't have it. And so we don't ask for anything but for you just to show up, and we're going to feed you and treat you like the family that you are here in the city of Chester.
All right, thank you. I did have a couple closing comments, and I'll just piggyback on what the council lady just said about this guy. And we got to get him here so you can meet him and see him. His name is Tucker Rodkey. He's an artist. He works with a lot of children in this town. He's been working around here for a long, long time. He's got a heart of gold. Sun Village Park. Let me tell you, you guys are never satisfied. And rightly so, because it's been a place that has been ignored and abandoned for a really long time. As soon as I came on council in Parks and Rec, we start doing some fixing up, and I'd ask the neighbors, ain't that good? And they were like, it's not enough. And you do something, it's not enough. It's not enough. So more recently, the playground that was built out there in 2022 now has a path around it, so I encourage you guys to go down there. It's a lot easier to access from all parts of the park. You've got to see this little network of paths that was put down there, some new benches, some new artwork, thanks to the Clean Air Council Legacy Arts kicked in the pavilion down there at Sun Village Parks. There's nothing more disturbing than to see a pavilion that's got graffiti on its pillars. Well, they've wrapped those pillars with art that looks beautiful, and then that's part of Tucker's work. And the chandelier in the pavilion is just the sweetest little touch. They're doing this work with old bottles that they paint and they cut and they form into flowers. You might see them on fences around the city. They made this chandelier that's sitting in the pavilion. It's such a beautiful touch. So thank you, Tucker. We're going to get him here so you guys can meet him. You're going to love Tucker Rodkey. I'm going to say that. To you guys, VMSC, we can't say enough about you guys, but some of the stats that you brought us today really justifies how difficult it is for healthcare in this city. A couple I'll just repeat: 16.5% of the patients that they've seen in the first 90 days are uninsured, resulting in $420,000 that will never be collected. We often hear, as mayor and council, and we still ain't got no hospital. Well, that's what makes it so difficult to have a hospital in an area like Chester, Pennsylvania. Hospitals need money to operate as well, and unless you have something like a Crozier that can accept people like in the community that it's in, the Chester community, they need other profit-making sections in that hospital. For Crozier, it was the burn center, it was the cancer center. They were delivering babies. Those are things that make the money. That has to supplement the care that they give to communities that just don't have the money for care. As a result, they mentioned expand, advance, and ensure. I wrote that down. Expand community access and care. They're working on that. Advancing community health and educational programs, they're working on that. And they're ensuring equity in care. They're working on that. But that's also something that's very much being done right here in the city of Chester through our Department of Health. If you follow Dr. Kristen Motley, and I'm sorry she just left the room, that's what she does. And I'll just speak to last Saturday, right in front of the clinic that's on 5th and Penn. She brought all the organizations together to do sort of a back-to-school health fun day where you could get vaccinations for your kids. They were actually doing sports physicals, you know, all this for free. All the stuff was out there health-related, which would have otherwise cost you if there was a primary care physician in your home. You really have to start paying attention to what we're putting out on the app, the Chester Connect app, and all these health-related things, because it addresses the community access and care. It's got to change. We don't have a hospital. These guys don't want to drive all the way to Christiana, Presbyterian, Penn, fly in helicopters. They want to take care of you as best that they can right here on site. But when they do have to go, they have to go. But to also hear the disturbing statistic that 33% of the people are refusing to even go to the hospital after you see the condition that they're in. Like, you don't want to take them in the first place. And if you make the call that you got to go to the hospital and they say no, that's a problem as well. So please, please, please pay attention to these particularly health-related events that go on in this town. The people who show up are from the hospital groups that we hope someday will end up taking Crozier Hospital and bringing up those services again, whether it's from Penn or Temple or Drexel or Jefferson, Christiana, the Department of Health. I mean, they were all there. You guys were there, of course, with your stuff. So thank you for that. And lastly, like, the star of the show today were you guys, the youth. Thank you for recognizing the fact that 2 hours sitting here listening to us do our business is a lot to ask, even for us. Okay, we want to, you see our solicitor already left, right? He's got things to do. But it's important for you to see how business is run. So ideally, this Chester City Council is to take care of Chester business. It's usually the laws, the ordinances, the resolutions. That's really all it's about. But it's a public meeting. So the public attends to witness what we do, and it's their opportunity to have 3 minutes to just vent, thank, award, whatever they want to do in that time. And you have the same invitation as any adult does any day of the week. So come back, talk to us about what's going on in school, what's going on in the neighborhoods. We need to hear you. We're here to listen. We're here to listen, so don't be a stranger. This was a great meeting. It went all over the place. A word that was shared by somebody who commented today, and it was culture. Chester does have its own culture, and it's becoming pretty clear that Chester culture is oozing in these city council meetings. It's not just about the ordinances and the planning and all that stuff. It's about you guys. So, you know, you show up, continue to show up, continue to watch, continue to review. We don't want you to miss anything. We want you all to be involved. We are listening here. There's a lot of spinning plates that are going on right now. There's a lot of things happening in the city. You're going to see some pretty exciting announcements in the next couple months. Trust me on that one. All of us are doing work in our own way. You know, some of us are out in the streets cooking. Some of us are out here being youth whisperers, councilman. We got our old pro here who's been at it for almost 15 years now. See? She even corrects me. And we got the guy right here who's going to probably have one of the biggest events on the Avenue of the States that the city has ever seen in the next month or so. And, you know, we're all doing our thing. Thank you to the directors who stick it out too. Many times, I'm telling you guys, you don't have to wait to come to council to talk about stop signs, potholes, and all that. Don't wait. Contact these people. They're here 24/7. Get the Chester Connect app. Pretty soon you'll be able to push a button and go right to the departments, but right now it's great for notifications. It's free. It's not tracking you. It's not some kind of Illuminati type of thing. It really is to better communicate. And lastly, I got to give a thanks. I don't see him here, but our IT guy, Tracy I can never pronounce his name. Bogans? Okay. He was very, like, knee-deep into getting the new phone system that we now have in the city of Chester. You might not do it, but let's give him a round of applause. I'm going to encourage everybody, though, if you're trying to reach City Hall, please call the main number. It's going to be a lot easier to get to where you want to go to. That main number is 610-447-7700. The menu of options that you have will direct you right to the departments you need to go. I can't tell you how bad the phone system was that was replaced, but I can tell you that what we have is state of the art right now. The more you can focus on the main numbers, there's a main number for police, there's a main number for fire, which I haven't memorized yet, but you know, 447-7700, burn that in your head. That's the only number you need to call to reach us at City Hall. If the persons don't answer at the front desk, you're going to go right to that menu system. And I'd say call it and listen to it yourself. It's fluid. If you think something should be changed, let us know. But I think we've figured out, you know, a way that the phones will work for you. There's nothing that breaks my heart more than to hear somebody say that I've called, I've left messages, and you probably did. And I have to honestly admit, that person may have never got your message because the phones were that jacked up here. And now that those phones are gone, I can talk about the new phone system, which that won't be the case. All right, you guys, can I get a motion to adjourn?
Second.
Well, they can't wait to get out of here.
Everybody's saying so moved.
Oh, yeah, photo. So don't go anywhere. How about if we just stand here, have them down here? Bring them on up. All right, and how you doing, bro? How you doing, man? Good to see you.
All right, good. Yep. Hey. All right.
Round them up, Miss Adrian. Oh, you want to do you know why? You do why? Yes. Y'all just on me.
Where did you go?
Oh, really? Okay. Watermelon people will be out there?
I don't know if they need to come. That orange watermelon?
I know. That's what I have.
That lemon on top of it. Hey, what's going on?
Yeah, you put it
outside.
Come on in. I have to wait for y'all to do something. On Sunday. I have a program for the kids. Oh, come on, talk to them. You don't never come down. I can
Down there, clear the front,
I I can get it there.
Councilman West probably.
No, you guys can sit down front, we'll be up here.
1 month from today. Yeah. Okay.
Yeah, the Friday I was gonna come, you guys didn't have it, I guess. For off job or something.
God is good, ain't he? Oh, wow. You told me to stop and take your time. I told him, I said, I'm going to get on the highway, and I'm going to just pull up. Just look.
The kids are staying right here. No. They're staying right in front. You guys are going to stand in front of them. Right down here.
That's a channel? I don't know what channel it's on, but you're saying the public aspect channel is on. Okay. This is the first I've heard of it. I'll look into it. Verizon, right? Verizon? Okay.
Hey, that was 1603 pounds.
Come on, Council Lady. Let's go.
Yeah, come get it.
Councilman Davis. Councilman Davis.
I love to see it's a lot coming from there.